of you, and there was no excuse for that.
Dr. Meier, what about the healthcare legislation and this whole issue of what was taken out of the legislation and what you think needs to be done? And, of course, the controversy around, quote, death panels and what it did to your field.
Well, that notion of death panels was pure lies. There was nothing even vaguely related to the attacks that were on the legislation. All the legislation said was that doctors should be reimbursed by Medicare for having conversations with patients with serious and chronic illness about their goals for medical care. It did not mandate those conversations. It did not require anyone to participate in them. It merely recognized that these are long conversations. They require a lot of time between physicians and nurse practitioners and their patients and families, and that as it stands now, physicians are essentially not compensated for that. The result of not being paid for doing those things is that those conversations almost never take place, because physicians are struggling to, particularly those in primary care, make enough of a living to pay their staff, pay their office rent, and be able to pay their own mortgage. So when faced with those kinds of financial pressures, understandably, many physicians are seeing as many people as they can in a day and don't see that they have time for a 45-minute or hour-long conversation with a patient who has a new diagnosis of kidney failure, for example, or a new diagnosis of cancer, to talk with them about the pros and cons of the treatment options, to understand what that patient's goals are, what their worries are, what their fears are, to help them understand their choices and to make good choices for themselves. All this bill did was say, we will compensate physicians for having those discussions if the patients want to have them. And it was twisted and deformed and surrounded by lies, precisely in an attempt to defeat any kind of health reform and also to harm President Obama's chances of re-election and the election outcomes in the 2010 November midterms. And it was very effective. It was extremely effective strategy. Unfortunately, it bore no relationship to the truth, and it scared the American public, which was the intention, away from getting the information. And information is power in healthcare, as in every other aspect of life, getting the information they need to negotiate the healthcare system in the context of a serious illness.
So has it set your field back at this point, and where does it stand with the legislation today?
Well, I had thought that it really set our field back, but when you think back on, for example, the Terry Schiavo debacle several years ago, there was enormous fear in our field that the American public believed that palliative care was about helping people shorten their lives or shortening people's lives to save money. But actually, the pendulum swung back the other way. The American public is not that easily duped. The American public understands how difficult it is to help a family member through a serious and chronic disease. The American public wants more time talking with their physicians. In fact, that is the #1 complaint of patients and families in the healthcare system, is that they don't have enough time to talk with their physicians about what's going on. So while I was quite concerned and distressed by what went on last summer around the death panels, I think the great middle of the public understands that this was hyperbole and hype, and it was political and it wasn't factual, or at least that's my hope. So what needs to happen from a policy standpoint? I think it's certainly important to compensate physicians for listening to and talking to their patients, and that is not in the current bill, but something that we'll be working on in the future. But it's also very important to encourage young physicians and young nurses to choose to specialize in this field, because right now we have a lot more demand for people who know something about palliative care than there are people to fill those positions. So I'm hoping the federal government will do something about the workforce crisis that we're facing, because with the growth in numbers and needs of older adults in our country with illnesses like the one your mother had, but also many other illnesses like dementia or heart disease or kidney failure, there's an urgent need for more people with training in palliative care, and we're going to need the federal government to help us meet that need.
And for people in hospitals now, for people who want to find someone in palliative care, can they just ask? Does every hospital have a palliative care department?
Well, I can't say every hospital does, but I will tell you that if you're in a hospital with more than 300 beds, which is where most people with complex or serious illness find themselves in this country, over 80% of hospitals of that size do now have a palliative care program. Unfortunately, many patients and families don't know that those programs exist. So like in anything else, you have to be an informed consumer. You have to demand to get your needs met. And it's very important. Call the hospital operator. Say, is there a palliative care program here? What's the phone number? What's their beeper number? Tell your physician that you want consultation from a palliative care team. Often physicians are hesitant to call palliative care in because they misunderstand and think that palliative care is only about brink of death care. Palliative care is about living as well as you can for as long as you can and helping to lift the burden of living with an illness. And physicians need to be educated, and they will be educated by you, the patient, and the patient's family. But you have to demand what you need.
And in these last few seconds, how important is the family when someone is sick?
You know, the family is the key to not only the patient's continued survival and quality of life, but the family also suffers enormously, suffering with their loved one and also suffering because of what they see happening to their loved one as a consequence of the illness and as a consequence of our very broken and fragmented healthcare system. So the family is very much the focus of the work of the palliative care team, because we believe that you can't help the patient if you're not also helping the family.
Dr. Diane Meier, we want to thank you very much for being with us, Director of the Center to Advance Palliative Care at Mount Sinai College of Medicine here in New York. And if you'd like to write to us about your own experiences, we'll continue this. And in the coming days, I will do a tribute, a long-awaited tribute to my mom. I couldn't quite do it in October, but now, as we would have been celebrating her 80th birthday this weekend, I'm going to try to pull together all my strength and tell you a little about who this great woman was. But Dr. Diane Meier, thank you for giving us the time, my brothers and I, and all my extended family, to have quality time with my mom in those last days.